Welcome to the Deep Dive. We're the place that takes huge piles of information and, well, boils them down to the key things you really need to know. Today, we're tackling a really serious topic in horse health, one that's maybe a bit misunderstood sometimes. Acute kidney injury, or AKI. You might also hear the older term, acute renal failure, ARF. We've dug through a ton of recent research, clinical notes, all of it for this deep dive. Our mission, simple. Cut through the complicated medical stuff, find those aha moments, and give you the essential insights to, really get what's going on with this major challenge for horses. Ever stop to think what happens when our horse's internal filters, their kidneys, suddenly hit a crisis? It's way more complex than you might imagine. It impacts so much more than just the kidneys themselves. Everything from energy right down to hoof health, believe it or not.
Yeah, and what's really interesting, actually, is how the names we use have changed. The terminology itself tells a story. So acute renal failure, ARF, that was kind of the original term for a total shutdown. But now, acute kidney injury, AKI, that term's really preferred because it helps us catch problems earlier, even, subtle kidney damage that might be happening alongside other diseases.
Ah, okay, so it's not just semantics.
Not at all. It's a big shift, really. It pushes vets and owners to look for those early warning signs before things get to complete failure. And catching it early, that can make a huge difference.
Okay, so let's unpack that. When we talk about acute kidney injury in a horse, what are we actually talking about? What's happening inside their body?
Okay, so at its core, both AKI and ARF, they mean there's been a sudden and sustained drop in something called the glomerular filtration rate, GFR for short. When the GFR drops like that, waste products, things like urea and creatinine, they build up fast in the blood. That's what we call isotemia. And it doesn't stop there. It throws off the horse's fluid balance, electrolytes, potassium, sodium, and even their acid-base levels. It's a real systemic problem.
You mentioned GFR. For those of us maybe not familiar with the term, what's a simple way to think about that? Sounds pretty vital.
Oh, absolutely vital, yeah. Think of the kidneys like incredibly efficient filters in a really complex system, like your house's plumbing, but way more advanced. GFR is basically the speed or the rate at which those filters are cleaning the blood. So when that rate suddenly plummets, it's like your filter is just clogged solid or maybe even broken. The underlying cause is usually, well, a kind of 1-2 punch. First, you often have issues with blood flow to the kidneys. We call that hemodynamic problems. And second, maybe exposure to nephrotoxic insults, fancy term for substances that are actually toxic, damaging to the kidneys.
Right.
And this initial damage, it gets worse because the GFR itself is low, and also because dead cells and debris can literally clog up the tiny little tubes inside the kidneys.
So what does this actually do to the horse then? You said it's systemic.
Yeah.
What parts of the body feel the effects besides the kidneys themselves?
It's surprisingly far-reaching. It really puts the whole body on alert. So obviously you have the direct injury to the kidneys, but then their endocrine and metabolic systems, they kind of go haywire. You get imbalances in crucial electrolytes, potassium, sodium, calcium, phosphorus. That can be really dangerous. Often they develop metabolic acidosis too, which is a shift in their body's pH balance. You might even see slightly high blood sugar or lactate levels. Then there's the gastrointestinal system. Horses often just stop eating, they might get diarrhea, and they're definitely at higher risk for stomach ulcers. Sometimes you can even see ulcers in the mouth or notice a sort of ammonia-like uremic smell on their breath. That's usually in more severe cases.
Okay.
And if it's really bad, the nervous system gets hit. Because of all those toxins building up, you might see ataxia, like wobbliness, or even encephalopathy, where they seem dull or mentally out of it. Their blood clotting can be affected too, and their immune system gets suppressed, making them more likely to get infections, like sepsis.
Wow.
And one really alarming thing in severe cases is acute laminitis. It can come on fast and be incredibly difficult to manage.
Gosh, that really drives home how interconnected everything is.
Yeah.
A kidney problem isn't just a kidney problem at all. It sounds like a full-body crisis. So this raises a really practical question. Is any particular type of horse more likely to get this? Or can it just, happen to any horse?
That's a good question. So full-blown acute renal failure is actually pretty uncommon, thankfully. But AKI, the injury part, that might be a fairly common secondary issue. It can pop up alongside lots of other diseases.
Okay.
Interestingly, there aren't really strong links to specific breeds or sexes. The ones we worry about most are very young foals, like under a month old. They're more vulnerable, especially if they need medications that can be tough on kidneys, or if they suffered oxygen deprivation at birth, or if they have septicemia, a body-wide infection. And this is crucial, Horses of absolutely any age can be affected. No horse is totally safe from it.
Right. Okay, here's where it gets really interesting, I think. What are the main things that actually cause AKI in horses? You said it's not just one thing.
Definitely not just one thing, no. And we tend to classify AKI into three main types based on where the problem starts relative to the kidney. Thinking about it this way really helps clarify the different ways damage can happen. So first, there's prerenal AKI. Think of this as a problem before the kidney, like with the supply line. The kidneys themselves might be perfectly healthy, initially anyway, but they just aren't getting enough blood flow. That's called renal hypoperfusion.
Okay, like not enough water pressure.
Sort of, yeah. Good analogy. Common causes. Severe dehydration is a big one, maybe from really bad diarrhea like colitis or heat stroke or just not drinking enough. It can also happen with hypovolemic shock. That's when blood volume drops drastically, maybe from severe bleeding or endotoxemia from something like colic or sepsis. Severe heart problems could also do it.
Got it.
And the really key thing here is if that low blood flow state, that hypoperfusion, goes on for too long, it can actually start to damage the kidney tissue itself from lack of oxygen. Then it progresses to the next type, which is intrinsic AKI or renal AKI. Here, the damage is directly to the kidney tissue, the filters, the tubules, the surrounding structures. The causes are pretty varied. A major group is nephrotoxic agents, toxins.
Like medications?
Exactly. Common culprits are non-steroidal anti-inflammatory drugs, NSAIDs. Think phenylbutazone, butane, or flunixin, banamine. Especially risky if the horse is dehydrated or maybe in shock when they get these drugs. They interfere with substances that normally protect kidney blood flow. Certain antibiotics, too, particularly aminoglycosides like gentamicin or amikacin, they're directly toxic to the cells lining the kidney tubules. And then there are other things, heavy metals, even vitamins D or K3 in really high doses of oxytetracycline, especially in foals, and even some plants to oak trees, pigweed.
Wow, okay. So lots of potential toxins.
Definitely. Another major cause of intrinsic damage is ischemic injury. That's just damage from lack of oxygen. It often follows prolonged or really severe prerenal problems, that lack of blood flow we just talked about. You see this a lot after bad colic cases or severe endotoxemia or even severe tying up exertional rhabdomyolysis where there's massive muscle damage.
Ah, tying up.
Yeah, and that leads into pigment nephropathy. When muscle breaks down massively, that's myoglobin, or if there's severe destruction of red blood cells, hemoglobinuria, maybe from something like red maple toxicity, those pigments flood the system and they are actually toxic to the kidneys. And finally, you can have infections that directly target the kidneys. Leptospirosis is one, or bacterial infections climbing up from the bladder called pyelonephritis. Then the third category is postrenal AKI. This is like a blockage after the kidneys. Urine can't get out properly. This causes back pressure, which damages the kidneys. It's less common, but things like kidney stones or stones in the ureters, the tubes leading from the kidney can cause an obstruction. Or sometimes a urinary tract rupture, like a bladder rupture in a newborn foal is a classic example. The urine just can't be excreted. So wrapping up the causes, general risk factors really boil down to anything that predisposes a horse to kidney hypoperfusion, that low blood flow state or exposure to nephrotoxins, especially if they're dehydrated at the time. Think colic, diarrhea, pleuritis, peritonitis, really intense exercise, tying up, severe infections, anything that puts major stress on their system.
So it's definitely complex, coming from multiple angles. Given all that, what are the actual signs we might see as owners? What should we be looking out for?
Yeah, that's the crucial part, isn't it? And the tricky thing is the early signs can be really, really subtle. That's because kidneys have this incredible reserve capacity. They can compensate for a long time. So you often won't see obvious problems until, maybe 50% or even up to 75% of kidney function is already lost.
Thanks. Okay. So what should we look for?
Often, the signs are pretty nonspecific, at least initially. The horse might just seem off, lethargic, depressed. That's often due to the uremia, the toxin buildup. They might go off their feed, have a poor appetite. If it's been going on a while, you might notice weight loss. Maybe their coat looks dull. Sometimes they show signs of abdominal discomfort, maybe acting a bit colicky or restless. And in more severe or chronic cases, you might actually see ulcers in their mouth or notice that weird uremic ammonia-like smell on their breath.
Right.
A really important clue, though, is that the level of lethargy and lack of appetite often seems worse than you'd expect for whatever else might be going on. If there's another primary illness, it just seems excessive. Then you have signs more directly related to the kidneys not working right. Changes in urination are key. A big decrease in urine or no urine at all. Oliguria or anuria, it's a huge red flag. A real emergency. But confusingly, sometimes early on, especially with certain types of damage, a horse might actually start drinking and urinating more than usual polyuria and polydipsia. You might also see edema, which is swelling, often under the belly or on the lower legs because they're retaining fluid. Sometimes even the conjunctiva around the eyes can get really puffy. And of course, signs of dehydration might still be present, especially if it started as a pre-renal issue. Poor skin tint, dry gums, and if the azotemia, the toxin level, is really high, you could see neurological signs that wobbliness, maybe seeming mentally dull or confused. On a rectal exam, a vet might be able to feel if the left kidney is enlarged or painful.
Okay, so if someone sees these signs, gets worried, calls the vet, how does a veterinarian actually confirm it's AKI and figure out what's causing it? How do they differentiate?
It's definitely a process, like putting pieces of a puzzle together. It starts with a really good history, what's been going on with the horse, recent illnesses, any potential dehydration, medications given, history of tying up, all crucial clues. Then a thorough physical exam. Checking hydration status is key: skin tint, gums, capillary refill, heart rate, breathing rate, listening to the abdomen. But the real story often comes from the laboratory diagnostics. Blood work and urinalysis are essential.
Right, the blood tests.
Exactly. We're looking for that azotemia, elevated BUN, blood urea nitrogen, and creatinine, CR. Creatinine is generally the better indicator of the GFR, that filtration rate. For AKI, even a small rise in creatinine, maybe 0.3 milli-GDL or a 50% jump, might be significant even if it's still technically in the normal range. For full-blown ARF, you see those numbers climb much higher, progressively.
And how do you tell the types apart from the blood work?
Great question. So if BUN and CR are up, but the urine is really concentrated, like over 1.035 specific gravity, and the numbers come down fast with IV fluids, that points towards pre-renal, just dehydration, essentially. If BUN and CR are up, but the urine is dilute less than 1.020, often around 1.008 to 1.012, what we call isosthenuric, especially if the horse looks dehydrated, that strongly suggests intrinsic kidney damage. The kidneys can't concentrate urine anymore.
Okay.
And if BUN and CR are sky high and the horse is making little or no urine or showing signs of blockage or rupture, that points strongly to postrenal. We also look for electrolyte imbalances on the blood panel. Sodium, chloride can be low, potassium might be dangerously high, hyperkalemia, that's life-threatening. Calcium might be low, phosphorus high. And we check for metabolic acidosis.
And the urinalysis, what else does that show?
Besides the concentration, the specific gravity, we look at the urine sediment under a microscope. Are there kidney tubule cells sloughing off? Are there casts, which are like molds of the tubules? Blood cells? Protein? We might also see glucose in the urine or pigments like myoglobin or hemoglobin if that's the cause. There are other more specialized tests too, like fractional clearances of electrolytes or checking for enzymes like GGT in the urine. And sometimes we test for leptospirosis if that's suspected. Oh, and there's a newer test, SDMA. It's a biomarker that might rise earlier than creatinine, potentially catching kidney injury sooner, though we're still figuring out its exact role in horses.
Interesting. What about imaging?
Yeah, ultrasound can be really helpful. We can do it through the belly wall or rectally. It lets us see if the kidneys look enlarged, if the internal structure looks abnormal, maybe increased echogenicity, or if the renal pelvis where urine collects is dilated. It can also help rule out stones. And in some really complex cases, a vet might consider a renal biopsy, actually taking a tiny piece of the kidney. It gives definitive info, but it does carry risks, like bleeding. And for monitoring fluid therapy in critical cases, sometimes we measure central venous pressure, CVV, to avoid fluid overload.
Okay, quite a diagnostic toolkit. So once you have that diagnosis, what's the plan? How do vets actually treat this? It sounds incredibly serious.
It is very serious. And the treatment really hinges on two main things. One, tackling the underlying cause, whatever kicked it off. And two, providing really aggressive supportive care to give the kidneys the best chance to recover. This almost always means hospitalization, often intensive care. So job number one is addressing the root problem. Stop any drugs that could be hurting the kidneys. Aggressively treat the colic, the diarrhea, the infection, whatever it is. Then the absolute mainstay of treatment is fluid therapy. Intravenous, 5E fluids. Usually things like normal saline, maybe other balanced electrolyte solutions that aren't high in potassium. The goal is to correct dehydration, restore good blood flow to the kidneys, that perfusion, and hopefully encourage the kidneys to start making urine again, what we call promoting diuresis.
Makes sense. Fluids seem key.
They are, and this is but you have to be incredibly careful. It's a real balancing act. Giving fluids too fast or giving too much, especially if the horse isn't peeing well, if they're oliguric or anuric, can be really dangerous. You can easily cause fluid overload.
Oh, right. You mentioned that earlier.
Yeah, even what might seem like not that much fluid, maybe 20 liters in a big horse, can cause serious issues like fluid in the lungs or swelling in the tissues if they can't excrete it. So monitoring is constant. How much urine are they making? What does their hydration look like? What's their body weight doing? It's very hands-on. We might add things to the fluids like calcium if levels are low, or sodium bicarbonate if the acidosis is severe and needs specific correction. Once the horse starts eating and drinking well on their own, we generally stop the IV fluids. There's really no benefit to just keeping them hooked up until the creatinine number looks perfect. Sometimes just adding a bit of salt to their feed can encourage drinking. Now, if the horse isn't producing urine despite being properly rehydrated, we might try diuretics. Furosemide, Lasix, is the common one. It's a loop diuretic. The goal is to try and, well, kickstart urine production. But critically, you only do this after you're sure the horse is hydrated and has decent blood pressure. You give a dose or two, wait an hour or so, see if it works. If not, more might not help. Some other drugs sometimes mentioned, like mannitol or dopamine, aren't really recommended anymore.
Okay.
And super important, avoid all nephrotoxic medications.
Yeah.
Absolutely no NSAIDs, no aminoglycosides, no tetracyclines. And you have to rethink the dose of any drug that gets eliminated by the kidneys. Nutritional support is important too. These horses don't want to eat, so you try tempting them with different feeds, mashes, hays. The need for a special low-protein diet like in chronic kidney disease is a bit controversial for acute cases.
Yeah.
And because uremia can cause stomach ulcers, we usually give gastrointestinal support like ulcer preventative medications.
Then monitoring?
Constant, like I said, checking hydration, urine output, body weight multiple times a day at first, looking for any puffiness, listening to their lungs for signs of fluid overload, checking blood work, the azotemia, electrolytes, acid-based daily for the first few days usually. That CVP line can help guide fluid rates in really critical ones, things like dialysis, renal replacement therapy. It's generally not practical or available for horses like it is for people or small animals. Maybe considered for valuable foals and very specialized referral hospitals, but it's rare. Wow, okay. Intensive is definitely the word. Given how serious it all sounds, what's the prognosis? What can owners expect in terms of recovery? Is it likely?
That's the million-dollar question, isn't it? And honestly, the prognosis varies a lot. It really depends heavily on what caused the AKI in the first place, how severe the kidney damage actually is, and critically, how quickly and how well the horse responds to treatment. Generally speaking, the outlook is pretty good to excellent if it's pre-renal AKI, remember, the supply line issue if it's caught early and fixed quickly with fluids before the kidneys themselves get damaged. Also, horses that remain non-oliguric, meaning they keep producing decent amounts of urine, even though their kidney values are high, tend to do better.
Okay, that's encouraging.
Yeah, and we usually feel more optimistic if we see those BUN and creatinine numbers drop significantly, maybe by 25% to 50% within the first 24 hours of starting aggressive treatment. That's a good sign. But the prognosis becomes much more guarded, even poor, if the horse is oliguric or anuric, making very little or no urine, especially if we just can't get them to start urinating again within, say, 24 to 48 hours, despite doing everything with fluids and diuretics.
Right.
It's also very serious if there's evidence of severe intrinsic damage, like widespread death of the kidney tubules or the cortex, or if they develop that severe hyperkalemia with heart problems or acidosis that just won't correct. Some negative indicators. If the creatinine is already over 10 milli-GDL when they first come in, that's concerning. Or if the kidney values don't improve or even worsen after that first day of treatment. It's generally considered poor if they stay anuric for more than 24 hours, if they start developing edema quickly, or if they remain oliguric for more than about 72 hours.
So time is really critical.
Absolutely critical. And even if they pull through the acute phase, there can be complications. We mentioned the fluid overload, the electrolyte issues, laminitis, which can be devastatingly fast and hard to treat in these cases, neurologic problems, GI ulcers or bleeding, even clotting problems, and long-term, horses that survive AKI might not have 100% kidney function return. They might have some residual damage.
Making them more susceptible later.
Exactly. More susceptible to future kidney insults or potentially developing chronic kidney disease down the road. It can take weeks, even 3 to 6 weeks sometimes, to really know how much function they've recovered.
Yeah.
So regular checkups and monitoring kidney values are usually recommended.
Okay. So knowing all of this complexity, all these risks, what's the absolute most important thing for prevention? How can we as horse owners help keep our horses' kidneys healthy and hopefully avoid these dangerous situations?
Yeah, prevention is key, and thankfully a lot of it comes down to anticipating and trying to avoid those common risk factors we talked about. The absolute number one thing, maintain hydration. It sounds simple, but it's crucial. Always, always ensure constant access to fresh, clean water. Encourage drinking, especially when it's hot, after intense exercise, or if they're sick with something else, like mild diarrhea. Maybe electrolyte supplements can help encourage drinking sometimes.
Right. Water is fundamental.
Completely. Second big thing, judicious use of potentially nephrotoxic drugs,
Mhm.
especially NSAIDs and those aminoglycoside antibiotics. Rule number one, make sure the horse is well hydrated before giving these drugs. Use the lowest dose that works for the shortest possible time. If a horse needs longer-term treatment, especially if they're older or maybe have some underlying kidney stuff already, talk to your vet about monitoring BUN and creatinine during the treatment. And avoid using multiple anti-inflammatories at the same time if possible.
Good advice.
Also, prompt management of dehydrating conditions. If your horse has severe diarrhea like colitis or a bad colic like a large intestinal displacement, getting aggressive veterinary treatment quickly is vital to prevent that prolonged low blood flow to the kidneys. If you have a horse prone to tying up, controlling exertional rhabdomyolysis is important. That means proper conditioning, making sure the diet is balanced, maybe using electrolytes strategically. And finally, know your environment. Be aware of and try to avoid toxic plants and pastures or hay that could harm kidneys, like those oaks or pigweed we mentioned. Really, the take-home message is that acute kidney injury is serious. It's a medical emergency. It needs fast diagnosis and intensive vet care. But being aware of the risks and acting early gives the best chance for a good outcome and helps prevent that progression to irreversible chronic kidney disease.
Wow. What an incredibly thorough deep dive. This really brings home just how vital kidney health is. You now have a much clearer picture, I hope, of how crucial those equine kidneys are, and importantly, what signs, even subtle ones, you should be watching for. We've really seen that AKI, it's serious, it's complex, often sneaky at the start, but has these huge ripple effects throughout the horse's body. Understanding the causes, from simple dehydration to specific toxins, and just how critical early recognition and that aggressive, carefully managed fluid therapy are, well, it's essential knowledge.
Absolutely. And thinking about all this, it kind of leads to a final thought for you to consider. We've talked so much about how vital hydration is, right? And how many common situations, travel, stress, illness, exercise can lead to dehydration. So the question to maybe mull over is, what everyday practices can you put in place starting now to make absolutely sure your horse's hydration is always, always a top priority, especially during those potentially risky times?
Definitely something important to reflect on. Keep thinking, keep learning. Thanks so much for joining us for this deep dive. We'll catch you on the next one.